It's HIMSS 2019 right here from Orlando, Florida, as this is CommonWell TV. Scott Adams here with you, and we're extremely excited to hear from CommonWell's executive director, that being Jitin Asnaani. And Jitin, with the alliance continuing to grow, how have you been working to make it more inclusive for different types of healthcare and health IT organizations, particularly smaller EHR vendors?
You know, our focus in the past when we first launched the Alliance was really to build sufficient mass such that we had a real network for people to connect to. And, we took those first steps in bringing in initial members really focused on that, even though we've been open since almost the very beginning. Now, the steps we're taking to make it easier for others to join us, I think a couple of big new inroads, new channels we've created really for organizations to be able to join us. Everybody's familiar with the care equality announcement we made last year, which allowed organizations who are available, who are connected via their networks into that governance framework to be able to also exchange with us. I think the announcement that we made last week, it has super potential. We're very excited about it. That was an announcement of the CommonWell Connectors program. Mm-hmm. And the knowledge is, the thinking there is, there are all these great data platforms and intermediaries, and people provide interoperability as a service, integration as a service to the long tail of EHR vendors, the long tail of providers and other types of health organizations, labs, pharmacies, and so on, who may not use EHRs. And the opportunity now to work with that community and get them connected up into all these other types of settings of care, not to mention things like HIEs, which are huge pockets of information and exchange and value throughout the country. So very excited about that program, the CommonWell Connector program.
That care equality connection, the milestone that you guys have been able to get with that. Maybe if you could touch a little bit more upon that, expound on the care equality initiative.
Absolutely. So the care equality opportunity, care equality is a governance framework that allows networks to connect to each other. From our perspective, the set of services that we enable so that you can really find where a patient is and go and pull their records without building point-to-point connections, that's super valuable within the CommonWell network. But its value is limited if we don't have everybody on it. And so we're going to continue trying to bring everybody on it. But organizations like Care Equality who have this vision that people always have individual networks makes a ton of sense as well. And so working with them and enabling networks of provider organizations and other kind of health settings to be able to connect to us through their framework just means that for the CommonWell member, for the CommonWell end user, they have the opportunity to exchange not only within a rich way within CommonWell, but also with partners who are outside of CommonWell and involved in the care equality framework.
The clinicians also benefiting from this greatly. You talked about the clients, the providers, but at the end of the day, it's those that are hands-on, on a day-to-day basis, seeing patients' records. It's a huge deal.
It's a huge win for caregivers of every sort, for physicians, for nurses, for social workers, for teachers, for parents, and obviously for the individual themselves. The ability to go and get that data. We're seeing anecdotes which we couldn't hear about before because of the limit of the initial size of the network. As the network has expanded, and now with our partnership with Care Equality, we hear more and more about patients who and clinicians as an excellent example, who are being able to see data in the ED, for example. I think we've collected a number of anecdotes from physicians in the emergency department who have said, because I pulled out that record from CommonWell, came from CommonWell, maybe came from Care Equality, the beauty is it's transparent. They don't really have to know what these things even are. I was able to figure out that, that medication that was our course of care that we would have prescribed to the patient while he was there in the emergency department, turns out he's allergic to it. We did not know. We wouldn't have known. And we have so many such anecdotes from a variety of care settings, specialty, primary care, emergency department. And it's just a beautiful thing that this is why we did it.
As health IT continues to evolve, what do you see here as some of the obstacles here at the very, very near future?
The beautiful thing is, a couple of years ago, the big issue was there was just not enough data in our pipes, right? We needed to get bigger. We needed to work with others like Care Equality and the HIE community and so on to be able to get better reach. And now we're more rapidly than I think we expected, reaching this point where on the near horizon, we may be getting too much data. We're going to be getting a lot of data. And There are a couple of things we're doing to try to address that. Working with our members to really understand how it is that they display and work data into the EHR so that there's great usability. This problem's been on the horizon for a while, so they've been thinking about it. The data itself, not just in CommonWell, but across the entire industry, is inconsistent. It sometimes lacks high volumes of clinical value, for example, the clinical note. So we're working with the larger community, not only with Care Equality, the Argonaut project with HL7, with ONC, to enable better documents with richer information to be produced. In fact, I'm sure most have heard of the regulations which just got announced a couple of days ago, right here at HIMSS, that required those notes that we helped specify in our collaboration with Care Equality and the Argonaut project last year to actually become part of the requirements from perspective of CMS and ONC. So the work we're doing is having a real, very real adoption, and I'm hopeful that that's going to create higher value for everybody involved in interoperability, including and not limited to CommonWell.
As 2019 is here and we continue to advance in the future and more members continue to jump on CommonWell, what do you see as some of the top initiatives here for 2019 for CommonWell to tackle?
I think that, if I kind of list out the top initiatives, apart from this data quality work, which is just so very important, I think, we are today and over the course of this week, been demonstrating event notifications. Mm-hmm. Event notifications, and oddly enough, we had started demoing it on the same day that the regulations came out, which said that we do need nationwide health notifications, so the timing for us was kind of perfect. But the big deal for event notifications is that you can utilize them for a variety of different transformative healthcare experiences, right? If you think about, hey, I want to manage my population of patients, particularly the ones who I know are particularly vulnerable as a clinician, well, then I need to be able to know where they're going and be informed of it, not just query at the moment they come into my hospital or clinic in very dire shape. If you're a health coach, completely flip it around. I'm a health coach, I take care of healthy individuals, I want to keep them healthy. Well, that's a different panel of patients I want to keep track of and keep them healthy, know that they're actually getting the care they deserve. If I am a long-term care facility, I need to know when that patient's been discharged from an ED. Actually knowing that helps me to prepare so that when that person arrives, I can take best care of them. So there's a variety of different applications which we didn't touch until first we had query retrieve down, and we're still doing work there. But the event notifications piece is really going to give us an entirely new dimension that I think is going to be helpful to all of our members and participants.
CommonWell's executive director, this guy's been working very hard over the past 6 years to make this alliance grow and grow. And for more information on how you might be able to become a member of our CommonWell Alliance, we invite you to log on to commonwellalliance.org. Thanks so much, Jitin.
Thank you so much.